Welcome to your pelvis and pelvic floor. I'm going to be going over the organs of the pelvis as well as some of the basics of the musculature, the connective tissues, the bones and joints, as well as talk about common dysfunctions and how to avoid them with exercise and even breathing techniques. Things like back pain, pelvic pain, hip pain, also incontinence, constipation, sexual dysfunction, and so on and so forth. This is a female anatomy, but other than a few details, all of this absolutely applies to males as well, because yes, you also have a pelvic floor. So let's go ahead and get started with the organs. Here we have a model, and on the very top, what you can see is the uterus. So the uterus in pregnancy is going to grow many, many, many times this size. And it's going to kind of come up and over the pelvis as it grows. That's why you get that pregnant belly look. Right underneath the uterus, what's helping hold it up and what's separating it from the bladder just a little bit is your broad ligament. So in pregnancy, there are common pains associated with the growth of the uterus. And one is the broad ligament, another is the round ligament that attaches the uterus to the pelvis. So because of that rapid growth, those two things can become an issue, and there are things that you can do to help mitigate or even prevent that. This is why I always encourage my clients to be practicing mobility, even flexibility. I can say that I have suffered no round ligament pain in either my first pregnancy or so far in my second, even in my 40s, which means that my body has not been used to this uterus growing for the first 40 years of my life. And so it's good to know that there are things that you can do to deal with that pain. We'll talk about that a little bit more in detail, but there's your uterus at the very top, separated a small piece of fascia, this kind of like a sling here, the broad ligament. And then on top of that, as I said, you have your bladder. And of course, the bladder is going to have a little outlet to the sphincter of the urethra, of course. Now, one of the things that's very common to be talked about with pelvic floor dysfunction is incontinence, peeing yourself when you don't want to. And women experience that a lot more than men for two reasons. Number one of the most stressful things that you can do to your pelvic floor is have a baby. It's a lot of weight and, of course, all the pushing through labor. Again, your technique in labor and your preparation for birth and your overall fitness. And it's not just the pelvic floor muscles. We'll talk about some of the skeletal muscles that also affect the pelvis. All of that can make labor and birth a lot less destructive for your pelvis and pelvic floor. However, it is really hard on this structure. So for that reason, women often are symptomatic, especially in terms of incontinence when it comes to pelvic floor dysfunction. Men also have a much longer urethra, so it's not that men don't experience pelvic floor dysfunction. In fact, sexual dysfunctions such as ejaculation when you don't want to, so premature ejaculation, and prostate dysfunction can absolutely be related, usually is, to the pelvic floor. So we have the bladder, and the bladder is going to be connected again to that sphincter, as well as the rectum, which is in the back here. So I'll take these out and give you a little peek at the sphincters and the pelvic floor bowl, because this musculature is really primary to our interest today. So we have, of course, in the back, a sphincter where the pooper is, and we have your for ladies, you have your urethra as well as the vagina. So you have two other sphincters here in the front. And as you can see, the musculature of the pelvic floor, I'm not going to bore you with all the details of the individual muscles, but you can see very simply, this is all that matters for most people who aren't going to be tested on this, that it is a bowl. Some people call it a diaphragm. And what's important to know is, yes, there are layers of muscles, and there are muscles on one side and the other. There are muscles in the front and there are muscles in the back. And what we can do when we practice pelvic floor exercise is we can be a bit more nuanced than just a Kegel, that you're squeezing your pelvic floor or thinking about stopping your stream of urine, or the popular thing, picking up a blueberry. I don't know where that came from. He had to pick a blueberry. But anyway, there are many ways to think about training the pelvic floor because you have many sides of it. So we can think about engaging the front of the pelvic floor, the anterior aspect, where you're thinking about the vagina, the urethra, the vagina in women. You can think about the posterior, and that's going to be ruling the sphincter of the rectum. You can also think about your side to side strength and your ability to contract one side over the other. So when I teach pelvic floor exercise, we use a lot of these nuances. And then we think about degrees of contraction as well as relaxation, because the thing is, sphincter control isn't just about strength. If your pelvic floor muscles are too tight, or heaven forbid, both tight and weak, you're going to have a lot of issues when it comes to sphincter control. You may again have pelvic floor pain while having intercourse, for males, premature ejaculation, also constipation. So we don't just want to squeeze all the time as hard as we can. We want to incorporate breath, which is going to help incorporate the rest of your core muscles, such as the transversus abdominis, the multifidus, with your pelvic floor action. We are a whole system. We don't just want to think about one group of muscles, or again, even more oversimply, just one muscle. A lot of my clients come to me and they're like, my psoas. And it's like, there's a whole system here that maybe your pelvic floor has to do with. So we are a system. And when it comes to training these muscles properly, we have to think about the whole thing. And we want to use nuanced exercises such as degrees of contraction, thinking about various sides, the right, the left, the front, the back, and also thinking about squeezing slowly as well as squeezing quickly, so you teach yourself how to contract quickly so you don't do things like pee your pants when you sneeze, as well as relaxation techniques, because many people, through a series of typical muscular imbalances, actually end up too tight, not just in these muscles, but in other muscles in the body. So you have a pelvic floor bowl. You also have two muscles on the outside that connect to your hips that form basically the wall of the pelvic floor. So they're not strictly inside pelvic floor muscles, but they do interact with the pelvic floor. And a lot of people will consider these part of it, a very important functional part, and that is your piriformis, which is one of your hip muscles. That's going to be a bit more posterior, and your obturator internus. So those muscles are going to attach to the hip in the hip socket. That's not very great, but you know what I'm talking about. And also to your pelvis. So they are important in terms of pelvic floor function as well. So again, it's not just pelvic floor exercises in and of themselves that can help treat these issues or keep you well trained in terms of strength and length. Hip exercises. Anytime you do a squat, anytime you do a leg rotation, things in Pilates, even doing splits and practicing splits correctly. This can all contribute to better pelvic floor function, but also it's not what you do, it's how you do it. If you do a whole bunch of, like, say, yoga, and you do 20 minutes of yoga on one side of your body, and you really tighten up one side and then don't balance that out really well because you're spending so much time on one side, that can muck up things for, so say, your SI joints. So it's not what you do, it's how you do it. And so when we think about the pelvic floor, we want to think about all sides of the pelvic floor as well as what happens outside, and in addition, what happens on the inside and how that connects to your core in general. So something to note, and this again ties into what many of the problems are in pelvic floor dysfunction, are you have joints in the pelvis. Now this model actually moves so I can show you. You have the pubic symphysis in the front here. So that's your pubic bone. You have your anterior superior iliac spine, which are your sticky outy hip bones. You can feel these really easily on yourself. So these are often bony landmarks that say Pilates instructors, for example, might bring your attention to, or someone who's doing manual manipulation, like a physical therapist or massage therapist, chiropractor. They'll look for these landmarks so they can see actually how your pelvis is sitting in your body, because the joints make it such that pelvises are not always symmetrical. They look symmetrical, but often they're very much not, because everybody has some degree of muscular imbalance. I've never seen a perfectly balanced body. And so these are things for us to be aware of, and we can treat ourselves very easily if we know how to do corrective movement. So this joint in the front, most people aren't aware of unless they are hypermobile, because it moves. This is not the best model, but you can see there's movement there. And so if there's any sort of shifting at all, it's going to be very, very painful, because underneath all of that musculature of the pelvic floor or pelvic bowl or pelvic diaphragm, as some people call it, it's a whole bunch of connective tissue, tendons and ligaments. And when any of these joints move, they're extremely well innervated. In other words, they have a wonderful communication system with your brain to say, I'm moving, don't like. And that translates to pain. This often happens in pregnancy, where pregnant women will experience pubic symphysis pain. Now, relaxin is a hormone that increases in pregnancy. It actually peaks at week 12, very early in the pregnancy, in the first trimester. Then it kind of goes down to somewhat baseline levels. Then it really ramps up at the end of pregnancy, obviously, because we want the pelvis to expand to make room for a baby. And what's really cool is, because the pelvis is so mobile, it will actually expand more on the top at the beginning part of labor, and then as the baby passes through, it will expand on the bottom for hopefully what would be the head coming out first. That's not always the case, but again, exercise can help you position your baby really well. I digress. So you will feel often pain in pregnancy, one would. If you're experiencing this expansion, that is due to the body's need to expand for the baby and the hormone relaxin. Again, fortunately, I can speak from personal experience here. In my first pregnancy, I felt this at the end, and I was very easily able to manage that, because if I hadn't, every step I took in the day would have been excruciatingly painful. Not to mention doing anything else that I really like to do, like dance or splits or yoga or playing outside, gardening, dealing with my farm animals. All of that would have been incredibly painful if I did not know how to manage pubic symphysis pain with proper exercise. That has to do with core, that has to do with pelvic floor, that has to do with hips, and it's pretty easy and very quick. I've gotten to the point where I can lay down on the floor, spend 3 to 5 minutes there, and if I have any pains during pregnancy, it's gone. And it can be gone for days if I do the right thing. Also, I'm doing that regularly, so I'm trying to keep myself regularly conditioned. So again, this can be very painful. It is a joint. At the posterior part of the pelvis, we have the ilium, these big, beautiful butterfly wing bones, as well as your sacrum. And in anatomy, they're not very creative about names. And so in between those two parts, you have your sacroiliac joints. And these typically have about 3 degrees of movement, but sometimes people are more hypermobile or tighter on one side, and that will cause anything from like shifting where the pelvis, this is pretty extreme, but the pelvis will be up higher on one side. You may have a slight tilting where the ilium on one side is anteriorly rotated and the other is in neutral, or even posteriorly rotated. Dancers who practice their splits only on one side would be susceptible to this kind of dysfunction. And as well, you have this little guy here, the sacrum, which does tilt forward and backwards. And it does it even when you just do a forward fold and come back up. It also does that again in labor when the baby is passing through, to let the head come through the top and then let the head go through the bottom. So amazing. However, if there is any imbalance in these, it's going to be very painful, because again, you have like a sheath of connective tissues that say to the brain, I am not even. I don't like it because there should only be about 3 degrees and it should be fairly symmetrical. So with that, we kind of have to zoom out a little bit and also look at the rest of the skeleton, because a lot of people will just think about, oh, just the pelvic floor by itself, as I mentioned, or maybe the pelvic floor and the core. But there are back muscles, there are leg muscles that are all intricately involved in your pelvic health because they attach to the pelvis, but they also attach to other things. One of these muscles, and this is one that I have a lot of experience with because I happen to practice a style of dance where we move our hips a lot, belly dance. And in particular, I've worked with a lot of dancers who are extremely one-sided, who perform, of course, on their best side. So they're practicing one side way, 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 way more than others. There's also just people who have a tendency to put all of their weight on one leg, who are very dominant on one side. And what this can cause is, again, an imbalance, not just in the pelvic floor, not just in the core, but also in your back muscles. So I'll see this very often where a dancer will have one hip hiked higher than the other. And one of the big contributors to that is a muscle that actually attaches to the back of the pelvis and then up to your lowest ribs and to the spine. And this is called the quadratus lumborum. And you have one on each side. And if one is shorter on one side than the other, say you have someone who, again, puts a lot of weight on one side all the time, or they do a lot of hip movements on one side with the heel off the floor, and they don't do that equally on the other side, this will actually become shortened. In addition to, of course, we want to look all the way around, the front. So your rectus abdominis can also get tighter on one side. Your oblique abdominals, which wrap, in diagonals, can also get tighter on one side. And this can even cause twisting of the pelvis, rotation of the ribs, shifting of the ribs, all kinds of asymmetrical things. But that rib stuff is not isolated in and of itself. It's going to cause imbalances and often pain in the pelvis and the hips and in the low back. Many, many, many people experience that. So your core muscles and your back muscles can also contribute to pelvic dysfunction, as well as another very common culprit. People will say, my hamstrings are tight. Well, your hamstrings, here's the pelvis. Here's your, what they sometimes call commonly, sits bones. This is your ischial tuberosity, and your hamstrings all attach to your ischial tuberosity. So you have 3, okay? So with your hamstrings, you're going to be experiencing perhaps, especially if they're tighter on one side, a pulling down of the pelvis. And that's going to be, again, a contributor to potential SI joint pain, low back pain, lack of flexibility, imbalance of flexibility or strength on one side versus the other. So hamstrings are also really important to balance, as well as, of course, hip flexors. And the psoas major is a very common one that people speak about because it attaches the iliacus and the psoas major together. The iliopsoas are 2 different muscles, but they work together. And they basically go from the front of the hip to the back. And so if especially one is tighter on one side, so say you're an athlete and you do your kicking with your dominant leg, you're going to tighten those hip flexors up more on one side by practicing that side over and over and over again. Again, if you're a dancer who, not in my class, but you practice your splits more on one side than the other, or you perform a lot and you perform your splits more on one side than the other, or your kicks or whatever it is, you're going to be creating an imbalance. And again, because that wraps around the pelvis, that can cause an imbalance. So we want to treat this kind of dysfunction looking at the whole body as a whole system. So I like to start with teaching proper breathing technique that applies to the pelvic floor. And you can apply that to movement. For example, most people breathe backwards when they do a squat. It's just not optimal for pelvic floor and core function. So we should be inhaling on the way down of a squat and exhaling on the way up. We should be inhaling as the muscles naturally lengthen and exhaling as the muscles naturally contract. It just helps the whole system work better. So your breath can help. Pelvic floor exercises, just isolated pelvic floor exercises, which should have nuance and variety. It's not just squeeze as hard as you can, right? You're looking at the various sides, you're looking at various degrees of contractions and various speeds of contractions, as well as the function of the back muscles, side to side, the hip muscles, the leg muscles. So you get a whole body regimen that keeps your pelvis and pelvic floor happy. That way you're not dealing with things like incontinence, sexual dysfunction, low back pain, hip pain, SI joint pain, so on and so forth. And the thing that I like to tell people, because that sounds very overwhelming, is it's not what you do, it's how you do it. You can find anything you love to do. I use my contortion practice to keep my SI joints stable. That same practice, if I do it in another way, could be a total nightmare. And I could get to the point where I'm in so much pain, I am no longer able to do what I love, my contortion practice, as well as walking or running or bicycling. Once you learn these principles, you can apply them to any movement that you love to do, and then you can practice building balance in your body all the time with the things that you love. So, as well, know that a lot of these exercises, it really only takes like 5-10 minutes a day. Sometimes if you're really in a place where you're very imbalanced and need to build yourself up a lot, I'll have clients do that 5 to 10 minute practice, maybe 2 or 3 times a day. But really, it's simple stuff. Anyone can learn it, and you don't need to walk around with those dysfunctions. I hope you enjoyed this, and I will be giving you a video all about pelvic floor conditioning next in the course. Thanks so much for watching. See you in the next one.